Stomach cancer, also known as gastric cancer, is a cancer that develops from the lining of the stomach. Most cases of stomach cancers are gastric carcinomas, which can be divided into a number of subtypes including gastric adenocarcinomas. Lymphomas and mesenchymal tumors may also develop in the stomach. Early symptoms may include heartburn, upper abdominal pain, nausea, and loss of appetite. Later signs and symptoms may include weight loss, yellowing of the skin and whites of the eyes, vomiting, difficulty swallowing, and blood in the stool, among others. The cancer may spread from the stomach to other parts of the body, particularly the liver, lungs, bones, lining of the abdomen, and lymph nodes. The most common cause is infection by the bacterium Helicobacter pylori, which accounts for more than 60% of cases. Certain types of H. pylori have greater risks than others. Smoking, dietary factors, such as pickled vegetables, and obesity are other risk factors. About 10% of cases run in families, and between 1% and 3% of cases are due to genetic syndromes inherited from a person's parents, such as hereditary diffuse gastric cancer. Most of the time, stomach cancer develops in stages over years. Diagnosis is usually by biopsy done during endoscopy. This is followed by medical imaging to determine if the disease has spread to other parts of the body. Japan and South Korea, two countries that have high rates of the disease, screen for stomach cancer. A Mediterranean diet lowers the risk of stomach cancer, as does the stopping of smoking. There is tentative evidence that treating H. pylori decreases the future risk. If stomach cancer is treated early, it can be cured. Treatments may include some combination of surgery, chemotherapy, radiation therapy, and targeted therapy. If treated late, palliative care may be advised. Some types of lymphoma can be cured by eliminating H. pylori. Outcomes are often poor, with a less than 10% 5-year survival rate in the Western world for advanced cases. This is largely because most people with the condition present with advanced disease. In the United States, 5-year survival is 31.5%, while in South Korea it is over 65% and Japan over 70%, partly due to screening efforts. Stomach cancer is often either asymptomatic, producing no noticeable symptoms, or it may cause only nonspecific symptoms that may also be present in other related or unrelated disorders. In its early stages, by the time symptoms occur, the cancer has often reached an advanced stage, see below, and may have metastasized, spread to other, perhaps distant, parts of the body, which is one of the main reasons for its relatively poor prognosis. Stomach cancer can cause the following signs and symptoms. Early cancers may be associated with indigestion, aura, burning sensation, heartburn. However, fewer than 1 in every 50 people referred for endoscopy due to indigestion has cancer. Abdominal discomfort and loss of appetite, especially for meat, can occur. Gastric cancers that have enlarged and invaded normal tissue can cause weakness, fatigue, bloating of the stomach after meals, abdominal pain in the upper abdomen, nausea and occasional vomiting, diarrhea, or constipation. Further enlargement may cause weight loss or bleeding with vomiting blood or having blood in the stool, the latter apparent as black discoloration, melena, and sometimes leading to anemia. Dysphagia suggests a tumor in the cardia or extension of the gastric tumor into the esophagus. These can be symptoms of other problems such as a stomach virus, gastric ulcer, or tropical sprue. Risk factors: gastric cancer can occur as a result of many factors. It occurs twice as commonly in males as females. Estrogen may protect women against the development of this form of cancer. Infections: Helicobacter pylori infection is an essential risk factor in 65 to 80% of gastric cancers, but only 2% of people with Helicobacter infections develop stomach cancer. The mechanism by which H. pylori induces stomach cancer potentially involves chronic inflammation or the action of H. pylori virulence factors such as CAGA. It was estimated that Epstein-Barr Virus is responsible for 84,000 cases per year. AIDS is also associated with elevated risk. Smoking. Smoking increases the risk of developing gastric cancer significantly, from 40% increased risk for current smokers to 80% increase for heavy smokers. Gastric cancers due to smoking mostly occur in the upper part of the stomach near the esophagus. Some studies show increased risk with alcohol consumption as well. Dietary factors are not proven causes, and the association between stomach cancer and various foods and beverages is weak. Some foods, including smoked foods, salt and salt-rich foods, red meat, processed meat, pickled vegetables, and bracken, are associated with a higher risk of stomach cancer. Nitrates and nitrites in cured meats can be converted by certain bacteria, including H. pylori, into compounds that have been found to cause stomach cancer in animals. Fresh fruit and vegetable intake, citrus fruit intake, and antioxidant intake are associated with a lower risk of stomach cancer. A Mediterranean diet is associated with lower rates of stomach cancer, as is regular aspirin use. Obesity is a physical risk factor that has been found to increase the risk of gastric adenocarcinoma by contributing to the development of gastroesophageal reflux disease (GERD). The exact mechanism by which obesity causes GERD is not completely known. Studies hypothesize that increased dietary fat leading to increased pressure on the stomach and the lower esophageal sphincter due to excess adipose tissue could play a role, yet no statistically significant data has been collected. However, the risk of gastric cardia adenocarcinoma with GERD present has been found to increase more than 2 times for an obese person. There is a correlation between iodine deficiency and gastric cancer. A genetic risk factor for gastric cancer is a genetic defect of the CDH1 gene known as hereditary diffuse gastric cancer (HDGC). The CDH1 gene, which codes for E. codherin, lies on the 16th chromosome. When the gene experiences a particular mutation, gastric cancer develops through a mechanism that is not fully understood. This mutation is considered autosomal dominant, meaning that half of a carrier's children will likely experience the same mutation. Diagnosis of hereditary diffuse gastric cancer usually takes place when at least 2 cases involving a family member, such as a parent or grandparent, are diagnosed, with at least 1 diagnosed before the age of 50. The diagnosis can also be made if there are at least 3 cases in the family, in which case age is not considered. Diagnosis. To find the cause of symptoms, the doctor asks about the patient's medical history, does a physical exam, and may order laboratory studies. The patient may also have one or all of the following exams. Gastroscopic exam is the diagnostic method of choice. This involves insertion of a fiber optic camera into the stomach to visualize it. Upper G series may be called barium röntgenogram. Computed tomography or CT scanning of the abdomen may reveal gastric cancer. It is more useful to determine invasion into adjacent tissues or the presence of spread to local lymph nodes, while thickening of more than 1 centimeter that is focal, eccentric, and enhancing favors malignancy. In 2013, Chinese and Israeli scientists reported a successful pilot study of a breathalyzer-style breath test intended to diagnose stomach cancer by analyzing exhaled chemicals without the need for an intrusive endoscopy. A larger-scale clinical trial of this technology was completed in 2014. Prevention. Getting rid of H. pylori in those who are infected decreases the risk of stomach cancer, at least in those who are Asian. A 2014 meta-analysis of observational studies found that a diet high in fruits, mushrooms, garlic, soybeans, and green onions was associated with a lower risk of stomach cancer in the Korean population. Low doses of vitamins, especially from a healthy diet, decrease the risk of stomach cancer. A previous review of antioxidant supplementation did not find supporting evidence and possibly worse outcomes. Cancer of the stomach is difficult to cure unless it is found at an early stage. before it has begun to spread. Unfortunately, because early stomach cancer causes few symptoms, the disease is usually advanced when the diagnosis is made. Treatment for stomach cancer may include surgery, chemotherapy, or radiation therapy. New treatment approaches such as immunotherapy or gene therapy and improved ways of using current methods are being studied in clinical trials. Surgery. Surgery remains the only curative therapy for stomach cancer. Of the different surgical techniques, endoscopic mucosal resection (EMR) is a treatment for early gastric cancer. Tumor only involves the mucosa. In this procedure, the tumor, together with the inner lining of stomach mucosa, is removed from the wall of the stomach using an electrical wire loop through the endoscope. The advantage is that it is a much smaller operation than removing the stomach. Endoscopic submucosal dissection (ESD) is a similar technique pioneered in Japan, used to resect a large area of mucosa in one piece. If the pathologic examination of the resected specimen shows incomplete resection or deep invasion by tumor, the patient would need a formal stomach resection. A 2016 Cochrane review found low-quality evidence of no difference in short-term mortality between laparoscope and open gastrectomy, and that benefits or harms of laparoscope gastrectomy cannot be ruled out. Postoperatively, up to 70% of people undergoing total gastrectomy develop complications such as dumping syndrome and reflux esophagitis. Construction of a pouch, which serves as a stomach substitute, reduced the incidence of dumping syndrome and reflux esophagitis by 73% and 63% respectively, and led to improvements in quality of life, nutritional outcomes, and body mass index. Chemotherapy. The use of chemotherapy to treat stomach cancer has no firmly established standard of care. Unfortunately, stomach cancer has not been particularly sensitive to these drugs, and chemotherapy, if used, has usually served to palliatively reduce the size of the tumor, relieve symptoms of the disease, and increase survival. Some drugs used in stomach cancer treatment have included 5-FU-fluorouracil or its analog capecitabine, BC-N-eucarmystine, methyl-CC-N-eusemestine, and doxorubicin adriamycin, as well as mitomycin C and more recently cisplatin and Taxotere, often using drugs in various combinations. The relative benefits of these different drugs, alone and in combination, are unclear. Clinical researchers are exploring the benefits of giving chemotherapy before surgery to shrink the tumor, or as adjuvant therapy after surgery to destroy remaining cancer cells. Targeted therapy. Recently, treatment with human epidermal growth factor receptor 2, HER2 inhibitor, trastuzumab, has been demonstrated to increase overall survival in inoperable, locally advanced or metastatic gastric carcinoma overexpressing the HER2 (NOI) gene. Of note, HER2 overexpression in gastric neoplasia is heterogeneous and comprises a minority of tumor cells. Less than 10% of gastric cancers overexpress HER2 in more than 5% of tumor cells, particularly in small samples such as biopsies, requiring the evaluation of more than one bioptic sample. Conclusion: stomach cancer is a serious but often preventable disease. Early detection is challenging due to vague symptoms, making awareness of risk factors crucial. Prevention through a healthy lifestyle, H. pylori treatment, and regular medical checkups can reduce the risk. Effective treatment depends on early diagnosis, with surgery, chemotherapy, and targeted therapies playing key roles in management.
Subscribe and follow My Health by Dr. J for more health videos.